Welcome to Well and Back, the podcast hosted by three passionate osteopaths and wellness entrepreneurs, Justine Treadwell, Chloe Lawton, and Lauren Malott. We're opening up our inner circle of holistic health practitioners we think everyone should have access to. Listen in as we share our personal and professional perspectives on how our bodies respond to our everyday choices, as well as our favorite health tips and tools to help us feel good and move well.
Wrapping up our conversation on Gua Sha, when we finish osteopathic treatments with lymphatic drainage in mind, we have a general pattern that we follow that would go along the lymphatic vessels and points of drainage. So above eyebrows to the temples, under the eye to the temples, back down around the chin, oral diaphragm under the chin, down the neck into the chest to complete that drainage cycle. We follow that pathway with lymphatic drainage in mind, like we were saying. But I've seen things out there about facial mapping and different reflexology points that are on the face that can affect the body distally, different organs specifically, or regions of the body. Can you touch on that?
Yeah. So when we're seeing a client, we're kind of looking at what's going on in different areas of the body or different areas of the face. Like around the eyes will indicate something about, especially under the eyes, something about the kidneys, even the inner canthus of the eyes, something with the heart, the between the eyebrows, the liver, and you've got areas like the large intestines beside your mouth, the heart around the nose, or even above the nose, the spleen, pancreas, your stomach, your lungs. There's all different areas that you're kind of looking at, or even if there's acne around the chin area, there's more hormonal uterus area, things are going on. You can do scalp acupuncture for different parts of the body as well. You could treat the whole body just from the wrists, the ankles. In different ways, there's these maps that are around.
So interesting. When you touched on meridian lines earlier, does the mapping of the face align with certain meridian lines, or can you explain a little bit more the concept of a meridian line in the body?
So the meridian lines, we have these 8 extraordinary meridians that are the first ones that are forming the fetus. And they're more tuned into your DNA, your curriculum, your soul impulse. So they're like activating how you're going to grow. And then you get the 12 meridians that usually we're working with for the body that are paired with the organs. So the gallbladder meridian, the liver meridian, urinary bladder, kidney, stomach, spleen, lung, large intestine, heart, small intestine. And when the meridian is affected, it doesn't necessarily mean the organ is affected. It's just the meridian it's attached to that organ, but it's a system. And that system is responsible for a certain type of energy or job within the body. And sometimes along that meridian, you can affect things that are going on with organs that are not part of that meridian line directly. Like the urinary bladder meridian runs down either side of the spine, down the back. And you can there's points that are for the lung, for the heart, for all of the organs directly. So if there's some sort of deficiency with the organ, you can start working with those points on the back. But then you've also got inside of the lung is a spirit point. So you can get onto that level too.
Those are tough concepts.
Yes. It takes a while, even when you're learning them, to drop into really understanding the depth and multidimensionality of the concepts of what's available or how the body is talking to all aspects of itself.
Yeah, of course. You've been studying this for years and years, and it shows. And it's interesting to just get a little glimpse into it and hearing your kind of rationale for assessing and how you end up using all of your tools in practice based on the client that you have is really really fascinating to us. I think when I speak for all of us, when I hear you talk about certain areas in the body and meridians and what you're recognizing in your assessment, I'm wondering what we would see osteopathically and wanting to compare patient.
Yeah, that would be super cool.
Yeah, really.
Yeah. Yeah, I appreciate having the opportunity to talk about it because usually you're just treating and doing what you're seeing, but it's nice to really share the depth of what goes on in the mind of a practitioner as they're treating, because really it's an art, just like I'm sure for you all, it's an art, because even with the different osteopaths that I've been to, I can see the different way they're approaching their art. And it's beautiful. The knowledge and the wisdom and the life experience that practitioners bring into their practice is unique in responding to who is in front of them and what's happening in front of them.
Yeah. So it seems like you put a big emphasis on the emotions of a person, how they're dealing with it, dealing with their emotions, how they're coping, how it's presenting in the body. So obviously you have a large knowledge base on that system of the body. Can you, and I know you host a course called Alchemy of Emotions. So please tell us all about that.
Yeah, thank you for asking. Yeah, I'm really excited. It's basically been what I've been working towards for a long time without knowing it. In society, we're really conditioned to block off from our emotions, and that ends up manifesting in our physical body as pain, discomfort, or in our experience moving through the world as anxiety, stress, frustration. And with Alchemy of Emotions, it's this year-long container that people come in when they're ready to do a super deep dive and they're ready to make a commitment for deep change, to be somewhere completely different a year from now, because I've tried all these things. And it's for people to step into emotional mastery and use their emotions as allies. So when they're experiencing something or a particular emotion for a long time, these are here to show us where we have opportunities for transformation and change. They might be showing us where we've been unable to set boundaries for ourselves or with other people, or we're always giving more and more and more and don't know how to say, I don't have any more to give. And they haven't found that balance to really make sure that they feel nurtured and enriched, and their cup starts being empty and their bandwidth of tolerance starts shrinking and shrinking and shrinking. When I first started studying shiatsu, which led me into Chinese medicine and acupuncture, I was blown away by a concept. The Taoist philosophy, and probably originates before that as the shamanic animism that happened in China before there was formed schools of thought. And that's based on the 5 elements and the seasons and even the organ systems that we've been talking about with the meridians. The pairs, they each belong into an element in a season, and the emotions that come up within that are attuned to what's happening in that season. You have emotions all through the year, but that time of year is when it's really obvious what the energy of that is, so that then we can work with it. So like spring is liver, gallbladder, frustration, anger, but it's also the sprout that's coming up and growing. It's got direction, planning, vision, and knows where it's going, right? And it's so when we start to understand the energies that are behind the emotions and working with ourselves in these cycles that exist in nature and that are reflected to us, and start attuning. And in the program, we're also clearing stuff that's blocking us from seeing that, like inherited perceptions and beliefs, mindset, and helps you get clear. Where's your authentic self in all of this? How do you create space and movement to be aligned with that? And then how do you align with these energies that are coming up and use them for your maximum potential? So it's a big course. It's hard to talk. I'm still figuring out how to talk about it in a succinct way, because inside it, there's the theory. Each module or season has like deep journaling prompts that really get you to go through the layers and look at everything. There's yin yoga practices for each season that help you feel in your body. So what different energies feel like. There's qigongs that's aligned with the different energies and seasons, because you want to move in different ways at different points of the year. There's mindset stuff. There's mantra to recode your frequency, basically, because all this information in life that you've inherited is frequency that's in your field. And that's why you're attracting the things that you're attracting. So when you're recoding all of that, you're starting to attract in with more intention and alignment. There's coaching. So it can be individualized and really hone into where your needs are at. Yeah.
Yeah, I loved what you said about when you're ready, you can jump in and it's a year-long thing, because touching on all the seasons, that could be at a different time for a different person. And
Yeah.
even today, our conversation starting as facial acupuncture with the idea of beauty and self-care, and someone may be listening for that specific reason, and then to hear the ties from that into emotions, they may have thought that they were coming in for a simple self-care focused topic. And maybe what they got from it was so much more. And that could be finding that way in. Is it going to be the physical side of things that starts your journey to healing? Or will it be that emotional side of healing where you start? And I think it's awesome that you're a person that's so well educated with so many experiences that can tie both of those worlds together. And I think that we're always looking for the most immediate fix. It's just the pace of society right now is looking for immediate results. So when somebody's coming to you for facial acupuncture, I know they're committing to a bit more of a journey, clearly, since it's like a whole body healing process. But what would you normally suggest frequency wise of appointments, or when you start to see those results in people for the superficial things that they first come in looking for, like fine lines and wrinkles?
That's a really good question, important one. It depends on the person too. So ideally, you're going in and you're talking with the practitioner you're going to be working with, and they'll suggest with whatever methods they're doing what might be ideal. But yeah, usually like 10 to 12 appointments, ideally 2 times a week when you're first getting it done, to just have that hit of collagen, and then you're good for a while. But depending on like how you hold your face and your stress and all of that, you might want to come in once a week, once every 2 weeks, once a month.
Individualized for each.
Yeah. And if you're working on other stuff, you might want to like get those things resolved. Yeah, it depends on many things. Depends on what you're working on, what your budget is, like where you're willing to invest your money. And then after you've had that initial 10, 12 appointments, maybe you want to do that once a year or something like that, depending on your age, where you're at, what you're trying to accomplish. And that way you can prevent having to get other procedures done, or sometimes it can complement that. Even the lip fillers, the needles can be put in a way that plump your lips up more, and the health of your spleen is reflected in your lips. So nourishing the spleen is going to nourish your lips more. So there's ways to do things to get your body to fill those needs.
It's so interesting that you touched on that. We were talking about this in preparation for today and wondered, are there any contraindications? So people who do have procedures like you described, fillers, Botox, or if they've had anything a little bit more traumatic, mesh, past scars or sutures in the face, is there anything there where there's contraindications or things that would limit the efficacy of acupuncture?
So when you're getting Botox, it's stopping the movement of your muscles in your face. And when you're doing acupuncture, you're wanting to bring vitality and chi and blood into those rather than freezing them. So you can get facial acupuncture when you've had Botox, but you probably want to wait a window of time.
So on that note, are they contradictory philosophies where with one, on one hand, someone might look at it and think, okay, these are two options for improving my youthful appearance by eliminating wrinkles through Botox. However, the principle behind acupuncture is restoring and promoting vitality in the body. And by introducing Botox as a neurotoxin, you are removing that muscle's ability to that contractility in the muscle itself. So, could you touch on that briefly?
Yeah, I'm going to touch on it from a place of intuition. I would think that it would be ideal to get some facial acupuncture after you've had Botox, because we don't want our faces to go into necrosis or we want our muscles to have blood and chi going into them. So that would be what my instincts would say. And that's pretty much where I can speak from it right now. And I know they can be done, just not in the same day or probably the same week, but I think if you've had that done, you want to make sure circulation is going, because you're not having the movement that's creating that circulation. So you probably want to encourage some sort of circulation going through there to just for the life of your cells.
Right.
Yeah, that's such a great point, because I feel people are either going one of two avenues, either thinking that they're going to take that natural approach and start with facial acupuncture and try that avenue, or it's like, okay, no, I just have to do the Botox and not have to think about it again for 6 months. But for somebody who has gotten Botox and likes that path and has seen results from that, to think about potentially incorporating acupuncture to avoid the potentially negative effects. Yeah, yeah, because thinking of the muscle energy and blood flow and lymphatic flow that might be affected through paralysis of those muscles,
Yeah.
you could still have that by maybe combining with something like acupuncture or facial massage. So it's a good point to not necessarily keep them completely separate entities. You can kind of find your own way of going about that.
Yeah. And in terms of scarring, acupuncture can help heal scars. I've worked with people who have breast removal scars in really reducing the scars, Caesarean scars where there's numbness from one area to the other. Acupuncture can help get those meridian lines reattached basically in some way, where the numbness starts to disappear and feeling starts to come back. So it's really working with the body and getting vitality to the different places and encouraging the body to do healing. You can bring the energy and vitality back and decrease the numbness or increase the sensation of actually being able to feel the area, and to start to bring sensation back into the chest, or facial scarring from acne that can be worked on to start minimizing it or reducing it. And it's all through bringing vitality back to the cells, and the blood and chi that travels through the body brings that vitality. And then the needles, whether they're like micro needles or acupuncture needles, are encouraging that to happen.
Wow.
Yeah.
It's almost, I'm curious of the mechanism of how, if that was something that was touched upon in your schooling, why the needle. We understand like the location and it being along a meridian line, but the needle itself versus pressure, how would you differentiate why that is bringing energy or chi back into line?
In Taoist Chinese medicine, in Taoist texts, like the really evolved practitioner becomes the healing instrument. Right now, we are using needles to say to the body, hey, go here and bring some blood and chi. But you can also amplify those needles through your intention and through the energy. So someone who's practicing, working with their energy every day and meditating, they're going to have a different energy around you for your healing. And when they're putting needles in you, there's going to be a different quality coming in. And same with acupressure. Sometimes that, like, shiatsu is quite a lot like acupressure. You're pressing along the meridian lines, and that can be powerful. So it's just like difference of tools. Do you want to get more specific in certain areas with what you're targeting, or is it like a generalized getting the body to come to homeostasis?
Yeah. So a lot about intention, which I think is really empowering, because anybody at home that may be starting something for superficial reasons, which we all have. I have fine lines that I can look at in the mirror and wish weren't there, or feel like I could reverse those. It's just, it's really cool to think that by my own facial massage or my own gua sha techniques or acupressure tools with certain intentions, can try and channel my own inner energy and body, nervous system, blood supply, everything.
And heal from within.
Yeah.
Basically.
Yeah, for
We're
sure.
magical.
Yeah, for sure. We are the medicine. Really, when we can get our minds in the right place, and remember I was talking earlier about frequency field, when we can start reprogram, because ultimately we're just frequency, we're vibration. So when we can start programming that, and that starts with simple acts of self-care and self-nurturance, and valuing this temple body that your spirit is residing in while you're here on earth. I'm going to get weird right now.
We're into it.
Okay. So this is the gift. This is the vehicle. This is the temple that we've been graced with, and everybody has a different temple, and they're all beautiful. Like if you go to an Asian country where they have the little temples on the side of the road where people are leaving offerings, and then there's like big fancy golden temples. It doesn't matter. They're all temples that house spirit, and they're all revered for housing spirit. So that when we can start to honor this temple that houses our beautiful spirit that has come down here to experience this realm, this human experience, so that we can go through the transformations that all the sensory organs and emotional organs have in interacting with our world, then we create a place where our spirit wants to be, where our spirit starts to settle and be into being here. So yes, at home, do the practices. Even if you're like, this feels vain, it's not vain. You're just taking care of yourself. Take care of yourself. Take care of your temple, so that your spirit feels like, oh, you're interested in me being here. You're creating a beautiful space for me to land. And beauty is not defined by the magazines or social media. Beauty is defined by you feeling true and honest and in your being, and taking care of your ability to respond to life. And that includes whatever routines make you feel radiant and contribute to your own radiance. And those are going to change over time, because we don't stay young forever. We get old, our bodies start to change and go into these different processes. And if we're stuck on that being our radiance rather than what's glowing from the inside, like, have you seen those like 80-year-old women who are just like lights and like shining? It doesn't matter what they look like, but they've maybe nurtured themselves in such a way from the inside out that it's just the radiance that, yeah. So gua sha at home.
No, that's a really, really great message. And it's the difference between maybe feeling selfish, taking time for yourself, which I think we all struggle with the pace of life right now. And it's not being selfish. It's really important to actually take care of you, whatever that looks like at whatever chapter.
Yeah. Like that gua sha combing over the head. I do that every night because my body needs the circulation, so that when I'm dealing with people, I'm not feeling like the gallbladder is impatience and frustration, I'm like, I'm calm and I'm present because I'm nourished and I can move into everything like, okay, all right.
Yeah, I think that's such a good principle, is just filling up your own cup so that you have more to give for others. And it also sounds like you're touching on, it's not so much what you're doing, but it's the practice of taking time to intentionally like give back to yourself. And it's more that practice than it is the efficacy of what you're doing. There's and there's healing in that act.
Totally. Not only are you looking after yourself so you can look after others, but when you look after yourself, you give others permission to look after themselves. Just like when you create boundaries, it might be difficult at first, but it gives other people to say what they need so that you can have clarity in your relationships. You're clear about what everyone needs. And yeah.
Oh my gosh, we could talk to you forever.
Sonja, thank you so much for all of your time. We touched on such a small portion of all of the things that we want to pick your brain about. So thank you. And we want you to come back multiple times to cover all these topics.
Yeah, I thank you so much for having me. It's been really wonderful to speak with you, and I really appreciate all the questions and where it went. And thank you.
Yeah, no, it's been such a pleasure for us. So we appreciate your time. And for those listening, where can people find you on social media, on your website?
Yeah, thanks. I'm at cedarhealingarts.com for my website. Cedar Healing Arts on Instagram or under my name, Sonja Elzen. If you want to book in coaching calls, they can be done virtually, or you can come in and see me at the clinic Align Living in Huntsville, or at my place, Cedar Healing Arts in Gravenhurst. You can check out the program. Or if you want a quick call to see if that's going to be a fit for you, you can email me and we can set something up. But yeah, thank you.
Thanks for tuning in to Well and Back. We hope you enjoyed this episode and gained some valuable insights into living your best life. Make sure to check out the show notes in the description for a rundown on today's episode. We are truly passionate about providing you with the best information and resources to help you on your wellness journey. For even more content, follow us on Instagram and TikTok at Well and Back. Please consider taking a moment to rate, review, and subscribe to our podcast. By letting us know how this episode resonated with you or what you'd like to hear more of, it helps us to continuously improve. Until you're back, we wish you well.